if the person has started the pregnant what do you call it, ANC somewhere first, and it's coming to your facility for the first time, choose new, right? Choose old, sorry. But if it's the very first time the person is coming to hospital during the pregnancy, then it becomes new. Subsequent ones, you always choose what old. Then here you can give your drugs to the patient. Any drug you want to give, or you can use a template which I have shown earlier. So to create a template, it's just a matter of coming to create template, adding the name of the template, and a description, which is also important. Then you can add the drugs, right? Whichever drugs you want to add. And then you put your dose, frequency, duration. And then you create. So once you create, it's part of a list here, midwife, and then you can add at any point in time. So if the labs are entered, like I showed you earlier, it will appear here, and you can easily see the results. But if not, you can prescribe a lab yourself. Yes. And then we have the scan. If you want to do some scan, you can search from here. Whichever scan you want to do, you select it. So now all these things might not be filled at a go. Depending on the person's what you call condition or level of pregnancy, you might fail some of these things or not fail some of these things. So we have the obstetric examination that should be filled every time the patient visits the facility. You just fill and you save. And then here we have some information that you have to fill: investigation results, tetanus, diphtheria, malaria prevention, IPT. So all these ones are important, but the one that you have marked it red are very important because of the Form A, midwife returns form. So once you fill this right, you're going to get your report effectively good with no problem. But the choice is up to you whether to fill or not fill it. But when you fill it, it's going to help you, the facility, and also the patient. So any tab here has its own add button. You click on add, and then you just see this information to fill. You go on the investigation results, click. You have all the investigations that the patient does. So at any point in time, the patient will do HB, sometimes at 28 weeks, sometimes at 30. So all these HBs, once the result is ready, you have to select it and then enter the, what they call the result. The dates is very important. So the same is also with what the PMTCT, which is also important for the Form A. All the other ones are not captured in the Form A, but they are equally important. So when you fill it, it's going to help. If not, you can leave it like that. But at the end of the day, information is key. So that is that. This is where you enter the progress or antenatal record, which is also entered. This one is actually entered every time, right? Every time the person visits the facility. But I think I made a mistake, I gave a wrong information. Here, it's only entered when the person does a scan, where you fill it. Yeah, so this is where you enter every time the patient visits the facility, and write also in their book. So sometimes you might be tasked to bill the patient based on something. So you come to the service bill, and then you select whatever you want to bill the patient. So anything that you want to bill the patient yourself, because that one you will best know what the thing is. You just click on service bill and select, and then the cost will be here, and then the quantity, and then you save. So these are things that you have to follow. Then we have the appointment. You can schedule an appointment for the patient, maybe next 2 weeks or next month or whatever. Select the dates, and then that is it. If you want to clear this particular space, you can just click on this to reset it. That's basically that. So if you want to pick the appointment date again, you can come here, and then so once everything is correct and click on the save, this will appear. If there's anything that you have done wrong, the system will tell you, and then to correct it. So assuming we are okay, we are correct, you can just save this. So that is that. So the next patient to be in the queue, select, and then you click on the ANC again. The same process. So here, whatever you did, as you can see, the registration, new registrants, mail involvement, yes, I first again seen at this. I can click on the view here to make necessary changes to this information. right?